Mr. Partlow. I'm Alexis. I'm your nurse practitioner for
Nice
today.
to meet you.
Do you mind if I call you Mr. Partlow?
That's fine.
Can you state your full name and date of birth for me?
Trayvon Partlow, April 5th, 1996.
And how would you identify yourself?
Male.
Okay, how are you feeling today?
I feel great.
Okay, so today I brought you and we're going to be performing a full head to toe assessment on you. We're going to be looking at all of your major organs, just kind of looking at your body systems.
Okay.
Okay, so I'm going to start with your skin. I'm just examining your skin. Looks pretty nice to me. Looks good for your race. Looks pretty moist to me. I don't notice any discolorations or pigmentation on there. Do you care if you just hold out your arms and I just feel your temp?
Yeah, that's fine.
Temp is nice and good. Like I said, your skin is pretty moist. No lesions noted or anything like that. I don't notice any cysts or warts. Do you have any tattoos or any piercings?
2 tattoos. One on my arm, one on my chest.
And what about piercings?
2 piercings in my ear.
Okay, now I'm just going to assess your skin tugger, looking by your clavicle area. Looks pretty good. And then your palms. Do you have any moles or have you noticed any new ones or anything like that?
No.
Okay, so now I'm going to move down and we're going to look at your nail buds. Try to see your hands. They look nice and well perfused to me. Nice and pink color. Cap refill is less than 3 seconds. No cysts or warts noted. In that area, they're nice and soft. Skin texture is pretty good and smooth. Now just measure your nail bed. Got about 130-degree angle. Now we're just gonna move down to your head and to your hair area. I'm just looking at your hair. Looks nice, well proportioned, like a dark brown color. It's evenly distributed over your scalp. I don't notice any lice or anything like that. So do you mind if I just touch your hair?
That's fine.
Okay, it's a nice and smooth color. Like I said, it's pretty well proportioned. I don't notice any lesions or any lumps like that. I'm just gonna palpate your skull. Your head looks nice and symmetric. I don't feel any bumps or anything like that. No depressions or anything noted. Your occipital lobe feels good, nice on palpation. Your face is pretty symmetric. Your eyebrows and eyelashes are pretty symmetric, evenly distributed hair. Do you care if I just feel on your sinuses?
Go ahead.
Your frontal sinuses feel good. Any pain or tenderness?
No pain.
Okay. Then your maxillary feels good. Your mastoid process is pretty good. And you said no tenderness or no pain or anything noted on there? Okay, now I'll just inspect your neck. I don't notice any webbing, no extra skin folds or anything like that. Your neck looks pretty symmetric to me. Can you just tilt your head back a little bit? Trachea is nice in midline. I don't notice any trauma on palpation, any deformities or lesions. No cysts or anything noted there. Now can you just turn your back towards me? I'm just assess for your thyroid. Now I'm just put my 2 hands by your thyroid, and when I palpate, I want you to swallow for me. Go ahead, swallow. Swallow again. Okay, everything feels good. I don't feel any enlargements or anything like that. Now you can face back forward. Now I'm gonna palpate your lymph nodes, your pre-articular, that's just in front of your ears, your post-articular, your occipital, as I palpated forward and back of your head. Everything feels good there. Your submastoid, side of your necks, everything feels good there. Your submandibular, the back of your chin, and then your submental, kind of the front underneath your chin, and then your subclavicle, and then your anterior deep cervical, front side of your neck, and then your post cervical. Any pain or tenderness on palpation with those?
No.
Okay, now I'm listening for any bruise or anything like that with the bell of my stethoscope. Now, when I do this, I want you to hold your breath for me. It's just a little easier for me to hear.
Okay.
Hold your breath. Okay. 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 Okay, so I didn't hear any breweries or anything like that, so that's pretty good. Now I'm just gonna palpate your TMJ for any crepidus or anything like that. Let me know if you feel any pain or anything like that. So I'm just gonna feel around and draw, and I want you to open and close your jaw for me. You can close it. Any pain or tenderness?
No, it
Okay.
used to click.
Okay, so I don't feel anything right there, so maybe that's resolved. Next, we're gonna move on to your vision. I'm gonna just look at examine your eyes, make sure that you have good reflexes and everything, all
Okay.
that above. So we're gonna do something called the Snellen chart. I'm gonna hold this back, and I want you to read the first line for me.
95.
And then, yes, you could cover your left eye for me.
No, 95.
And then what's this?
874.
Okay, and then cover your other eye for me.
95. 874.
Okay. So your eyes look pretty good there. Now we're going to do something called the confrontation test. I'm going to just have you cover your eyes and then tell me when you see my finger coming in. So we start with your left eye.
I see it.
Okay, we'll move over and I'm going to do with your right eye.
I see it.
Okay, perfect. Now, as I said before, I inspected your eyebrows, eyelashes, everything looks evenly distributed. They look pretty symmetric. Your sclera area is a nice white color to me. I don't notice any discharge or any foreign objects. I'm just putting on your eyelids and look at your conjunctiva. Nice pink color. No drainage or anything noted there. Now I'm just going to grab my pen light and I'm just look at your pupils, make sure that they're symmetric. Just look straight ahead. Okay, now I'm just gonna, and your eyes look pretty symmetric, your pupils are reactive, about +2. Now I'm just step back and I'm just having you look into the light for me, just checking for your light reflection.
Okay.
Your iris is a nice brown color, and your lacrimal gland looks good, no drainage or redness noted there. Now I'm gonna have you look into my light and I'm gonna move all the way into you. I'm gonna just look at your reflexes again there. So just look straight to the light, straight ahead. Okay. Okay, perfect. Now we're gonna move on to the 6 cardinal field test. I just want you to follow my finger. We're gonna start with your left eye. Perfect. Okay, so your retina color looks good, red with no lesions noted. Your blood vessels are good. I don't notice any webbing or any space in there. And then your depth of your anterior chamber is about 3 millimeters, which is normal. Now we're gonna move down and we're gonna look at your ears and assess for your hearing and everything like that. When I'm just inspecting your ears, everything looks pretty contoured, looks symmetric and in line. I don't feel any bumps or lumps on your ears or anything like that. Any tenderness or pain when I'm feeling on it?
No.
Okay, now I'm just grab my light and then I'm just looking inside your ears. Make sure you don't have any lesions or anything like that noted. Just look at your canal and your tympanic membrane. Just pull your ear up and back. There's a little earwax in there, but everything looks good. I don't see any inflammation or anything noted there. Back. And a little bit more wax in that ear, but everything looks nice and pink. I don't notice any inflammation or anything noted there. Now we're gonna move down to the like I said, we're gonna listen, do some hearing. So we're gonna do something called the whisper test. I'm gonna have you cover your left ear and I'm gonna whisper something to your ear and I want you to tell me what you hear.
Okay,
So we'll start with
my left.
Yep.
Baseball.
Okay, we'll move to the other side. Do the other ear.
Apple.
Okay, good. Now we're gonna move something. It's called the Weber test. So I'm gonna get my tuning fork and I'm gonna put it in the middle of your forehead and I want you to tell me which ear you hear the vibration in.
Both.
Okay, perfect. Now we're gonna move something called